A lower GI bleed is a bleed that originates distal or below the ligament of Treitz. Common causes include hemorrhoids, which are dilated veins in the rectum or anus, diverticular disease, which is inflammation or erosion of small pouches in the colon wall into a blood vessel, colitis, which is inflammation in the colon, for example, inflammatory bowel disease, causing mucosal bleeding, angiodysplasia, which is small, fragile, abnormal blood vessels in the colon wall, and a malignancy, which is colon cancer, which can present with bleeding. Now, what would you expect to see? One of the key signs is hematoschisia, which is the passage of fresh, bright red blood from the rectum. The volume can range from streaks on the toilet paper to large volume bleeds. Some of the other associated symptoms you might get are cramp-like abdominal pain and diarrhea. Severe bleeding will lead to signs of hypovolemic shock. Often this bleeding is painless, such as if it's from hemorrhoids. The out-of-hospital management for a lower GI bleed. Generally speaking, management is guided by hemodynamic stability. A small self-limiting bleed may not be an emergency. However, a large volume lower GI bleed is managed identically to a severe upper GI bleed. 1. Assess for hemodynamic instability. 2. Manage ABCs. Secure airway, provide oxygen, etc. 3. Aggressive fluid resuscitation. If an ambulance is called, they'll insert an IV cannula and administer fluids to treat signs of shock. And 4. Urgent transport. It's important that you call an ambulance so they can transport the patient to an appropriate facility for further investigation and management.